Hi, everybody. So, welcome to our functional yoga medicine episode. Today's episode is episode number 63, how to apply modernized functional medicine in your health and wellness practice. Because here's the thing. There's a lot of podcasts out there. There's a lot of big brands and big names touting functional medicine. I'm not so sure to what extent that the general public understands what functional medicine is. But as somebody who was super excited about functional medicine when I first found it, probably over 12 years ago, I know all the confusion as a practitioner and a patient that functional medicine can bring. Now, at the time, I was super excited because it was a credible source of information for me. Because to me, it was important that it was coming from credentialed providers, which Dr. Jeffrey Bland and all the founders of the Institute of Functional Medicine, Mark Hyman, Amy Myers, everybody was touting, and they were getting big on the internet with their e-commerce supplements. And then come Dr. Oz with all of his hypes, a lot of pharmacists and a lot of different practitioners began to sort of promote this idea of the marriage between East and the West, holistic versus conventional, to make it what it is today, functional medicine. So let me tell you why I feel like, well, I'm going to share with you the challenges that I had when I was going through the program. I think because the way we were trained at first, we call it AFMCP, I believe. It's applying the functional medicine principles in practice, right? And so it was a year-long, I guess, like a workshop or training that we get through the Institute of Functional Medicine. That's where you get an overview. And the idea is that when you go back to your practice by Monday, you should be able to apply some versions of what you learned through that week, which is great, right? And that was what got me started. And then there is the immune systems review. And then there is the cardiometabolic, there is the detox, there is nutrition, there is transport, there is endocrinology, like hormones, women's health, and all those things. And there's different types of subspecialties after the week-long session. And that's what takes so long. And those subspecialties are 3-day-long courses wherever it was being offered around the world. And of course, I chose to go to ones that were in the States for convenience. And here's the thing, you guys, I realized in coaching, right? Why I got into coaching was it didn't matter, me as a practitioner, how much degrees that I have or how many letters behind my name, as well as how much I know in theory. It's if I can't get my patients to go from point A to wherever they need to go, which is healed, then I'm not making any impact in the lives that I serve. So I began to ask a lot of questions after the fact, okay? I was gung-ho about this program. It took me about 7 years to get fully board certified. It was a rigorous process of doing case studies and submitting the case studies and sitting for the boards and then passing the boards. And then you have to maintain certain level of membership every year to be part of this IFMCP, right? Which is all good. But at the time, this is all I knew. And I started to think about, okay, how could I have better improved that experience? Because here's the thing, we as practitioners and me as a practitioner and an autoimmune patient, I didn't appreciate sitting like sardines in a can in a room full of people and then getting shuffled to be sold supplements, testing, and different types of everything else in between, and platforms, digital platforms, all the things. And I felt like very, I don't know, not intentionally, but taken advantage of. But not only that, my mind was blown away with so much information. Imagine if I were to say, okay, listen, I'm going to teach you all the things that I know. And then I get a hose, plug it into the hose, and then I kind of shut on the water really, really hard to the max capacity. And then I start pouring all the water that I have inside. And then I point that water hose at you. At the end of the weekend, you'll be probably like super wet, but you probably didn't consume or retain any of the information inside. Okay? You're wet, but nothing's shifted or changed on the inside. Well, I recognize how most practitioners feel. Even though we are the experts of holistic medicine, the experience of teaching or experience of learning was nothing but very toxic, because you can't, one, retain information that way. And yes, we do have the information forever on our portals as members of the Institute of Functional Medicine. But I just kind of felt like there was so much information that when there's so much information, what does your mind do? It just gets overwhelmed and then it gets paralyzed. It doesn't do anything, right? And so I had a difficult time going back to the information that I needed to go back to retain all the things that I needed to make sure. But the problem is that the motivation and the time in running a practice and all those things were very, very limited. Once you get into the Institute of Functional Medicine, you're sold their digital platforms, and then you're sold Coaching Academy to get coached or get your employees to go for this certification, which is like $7,000. And then there's digital platforms, like I mentioned, practice management tools, as well as coaching, business coaching. All the things are all extra. And then the supplements, the testing. And again, it's not about the information, but then now they're trying to sell you all these other things through the exhibits. And it just got too redundant, too overwhelming. And so my whole philosophy became, okay, in the program that I need my practitioners to learn, number one ingredient is compassion and empathy, and really trusting their intuition as opposed to theoretical knowledge, and really transform lives by being the example of what's possible versus telling them what to do, right? Because behavioral change is layers deep. It's not just superficial. We can't just give them a diet and wonder why they're not following through. Is why I think you too recognize as a client, or not client, but as a practitioner, there's a lack in our ability to impact lives because we're not as adept at coaching somebody through whatever they need to break through the mental barriers or limiting beliefs that they hold, to question things, to see their lives and circumstances differently, to not only inspire, but to evoke a response towards the thing that they want to get, and then reveal what's keeping them from getting whatever it is that they want so badly, but they don't have. And that's the stark difference between knowing the difference between being the person you need to be to achieve the goals that you want versus doing all the things, busy, doing all the things and wondering why you don't have the thing that you want, despite the fact that you work so hard, right? So sometimes less is more. If you're being the person that you need to be, sometimes it's as simple as visualizing who you need to be. But a lot of my patients, including you, practitioners, aren't very clear on what's possible. You're conditioned to the extent that your past dictates. Meaning, if you grew up in a household that limited you, or you have some age-old belief systems or limiting beliefs that hold you back, to say, I grew up on the wrong side of the tracks, money is hard to come by, money is evil, success is this, all the things that you bring to the table, you have to start to condition or really question. And these are the things that I think as scientists and tangible evidence-based practitioners that you and I are, we never question. So I want you to know that getting to the root cause of disease is really the motto for functional medicine as it gets popularized. And while there's a lot of truth to the statement, I feel though, at times it's overcomplicated, like I emphasized, and we are given information with a fire hose hydrant where we get super wet, but we retain nothing. And it's over compartmentalized or specialized, so much so that if we fail, or so much so that we fail to be able to put the puzzle pieces back together, we don't even know what the whole looks like, right? So I want you to understand that in the functional yoga medicine certification, I emphasize the SGIB model. And really modernized functional medicine piece with its 3 pillars is only one element of the 4 essential elements that you'll be learning within the program. Because it's not just about functional medicine. You need timeless wisdom. You need transformational psychology and coaching tools, as well as you're going to need to be an expert at business mastery, right? And so the third element is really the modernized functional medicine, right? Within the functional medicine or the modernized functional medicine approach, I divided it into 3 essential functions of the body that we absolutely need, that absolutely contributes to disease. And that's stress-brain connection, also known as hypopituitary adrenal axis, as well as hypopituitary thyroid axis. And every endocrinological hormone is discussed within the context of that. And then we lead into gut permeability, gut-brain connection, which is your enteric nervous system, autonomic nervous system, digestive system, right? When in doubt, you treat the gut is what we're taught. But if you don't treat the stress that precedes the gut permeability, then just because you treated the gut, you don't have the whole picture. So stress brain first, then the gut brain, enteric nervous system. And then lastly, it's immune brain. And I go deep into psychoneuroimmunology as well. Psycho is more the mental states. Neurological is more biological, neurological, the electrical impulses and synapses and all the things that we can measure through EEGs and CT scans of the brain and its activities and nerves. And then we have immunology, where through the gut permeability in the SGIB model, the enteric nervous system, then it opens up tight junctions in the gut to bring in the toxins, which then has an inflammatory response, and that brings in more immunological triggers to really perpetuate this immune system. And when the immune system gets confused and overloaded, it starts to attack its own tissues. And that's when you have a full-blown autoimmune condition, is why I tie it all together, right? And so again, stress brain, gut brain, immune brain, those are the 3 pillars of the modernized functional medicine with respect to how that operates physiologically, what the dysfunction patterns might be. We do discuss the epigenomics, microdysbiosis, and microbiome, and all the supplements and diets that might be warranted at certain phases and certain dysfunctions, and what key indicators to look for, what labs to test, and what diets are best, as well as some certain interventions, supplemental interventions, such as some parasite, addressing some parasites in your gut, to address SIBO, as well as hydrochloric acid deficit or hypochlorhydria, which is also giving them betaine tablets, sometimes bromelain or pancreatic enzymes, as well as certain supplements that the patient might be needing or is not getting enough of through the lab testing you might do, or purely from a standpoint of clinical science, right? So these are all things that you need to consider, but I'm not interested in giving you all the information like I want, like most of the programs do, through a fire hose, and then make you all wet, but nothing is retained on the inside, because this is the pattern I see. Here's the truth is, many practitioners I've met over the years, they all are super confused as they are. A lot of the functional medical practitioners are confused. And if you ask them, while some of them get good results for a certain number or percentage of the patients, a lot of the times, if they're being real honest, they'll tell you, unless the patient is fully involved, nothing else happens at the next level. And a lot of them are frustrated. A lot of them are overwhelmed. A lot of them are struggling with imposter syndrome, and they're struggling with not good enough scenarios, confidence issues of always chasing the next fad or anything else that they get asked about by their patients. And that's no way to serve your clients, is why I created the functional yoga medicine. Because for me, I wanted my practitioners to make eye contact with me, be empathetic towards what I needed, treat me like a human being, empower me and then pull me out of my victim mindset. If somebody would have done that 21 years ago, I not only would have prevented a failed marriage, but I would be a much different person today. But either way, this is the reason why I have this podcast and this program and all the things that I offer through my business. And so this is the way it's supposed to be. But I wish there were more practitioners like you who care enough to go to the next level to say, you know what, this is the missing piece and I need to tie it all together. I'm not interested in knowing more and getting more letters behind my name to serve my ego so much, but I really want to make impact in the lives that I serve. And I really want to be a powerful health mentor, really go away from powerless health technicians that you and I are taught to be. The time has come where we must make a shift and begin to be the change we want to see in the world. And yes, this is how you can apply the modernized functional medicine in your own health and wellness practice to provide your business with all the things that it needs to help it succeed, both financially, both in its impact in every element by applying the alkaline methodology, as well as to apply modernized functional medicine in a simple but effective way by shifting their perspective and really empowering your patients from disempowered victims to self-empowered healers that they need to be. And so that your role now becomes very clear to them that you're the trusted mentor as opposed to you trying to fix them, because that's a broken strategy in and of itself. So again, you guys, thank you so much for listening. I so appreciate you. And I would love it if you would subscribe to our podcast. It's called Functional Yoga Medicine, one of its kind in anywhere where podcasts are played, Spotify, iTunes, wherever you see it. And please leave us a review. And that would mean the world to me, because then I get to spread the word about this program, as well as to really share the news and deliver a different way of thinking. As well as you can always find me hanging out in Instagram at Dr. Connie Jian and at Functional Yoga Medicine. And I share a lot of things there that might cause you to think a little deeper and always challenge you, both professionally, spiritually, physically, emotionally, and mentally. And so I, again, thank you so much for watching, listening, however way you're consuming this information. And I will see you guys all next week. Thank you so much for joining. Bye for now.